Senator from West Virginia.
Thank you, Mr. President, for recognizing me. And I want to thank the chairman of the Help Committee here in the Senate from Tennessee, who made a very passionate, I think, argument on why we should be passing the bill that contains the Zika funding, but also for the opioid and heroin abuse overdose issue that we have in this country. He did mention the Hatfields and McCoys more than a few times in reference to Tennessee and Kentucky, but we've got to throw West Virginia in there, I think, because we have a good history of Hatfield and McCoy. We understand a feud, and I don't like to see a feud over these issues either. This is health care, this is women and babies, this is families that are just torn apart by this scourge of opioid and heroin abuse. I'd like to talk today about the Comprehensive Addiction and Recovery Act, known as CARA here, and strongly urge my colleagues to lay down the feud and have common sense. And I'm going to talk about why this is so very important. It's a comprehensive step forward. It's been worked on for years. This is not just a fly-by-night bill. This is a very comprehensive bill that's a national response to the drug epidemic that we see just like a fire brushing across America. It expands prevention and education efforts and promotes resources for treatment and recovery. I say often that there's no one solution to this problem. There's a spectrum of solutions. And CARA really addresses a spectrum of solutions. It helps law enforcement respond, provides resources for treatment alternatives to incarceration, which I know many senators here have been to see and visit drug court programs that have had successful graduations, that have gotten people back on their feet. They operate in West Virginia and many other states. I was very pleased to see many of the elements of the Senate passed bill included in the final conference report. Members on both sides of the aisle, and the senator from Tennessee talked about many of those members, have worked hard to create the realities and the needs of those living with and impacted by addiction. The bill is just a common sense response, so let's have a common sense vote in response to a common sense bill. For me, my personal passion here has been having to have the ability to craft several provisions that are included in this conference bill. One that would provide for safer and more effective pain management services to our veterans. Too many of our veterans are having opioid abuse and opioid overdoses in conjunction with care at the VA. Another provision that would co-prescribe naloxone with Senator Kaine from Virginia, a drug that reversed the effects of opioid abuse or overdose with prescription opioids. Another provision that would increase access to important follow-up services. Again, another bipartisan amendment to prevent overprescribing. Also, a provision that would improve acute pain prescribing practices. If you have acute pain, it's different than having constant pain. So, what are the prescribing protocols for that? We have too many stories of addiction. It started with patients taking painkillers after suffering a minor injury or a minor surgery. Also provisions that would allow doctors to partially fill certain opioid prescriptions. Senator Warren from Massachusetts, we worked together on this. This helps to limit the availability of unused painkillers. And lastly, a provision that I worked with from my colleague from West Virginia on the House side, Congressman Jenkins, that would protect babies that are born exposed to opioids during pregnancy and get them the specialized care they need. We see it in Lily's Place in Huntington. We need to have this across the country. So in March, we stood together. We stood together and passed this bill 94-1, broad bipartisan support. And CARA has had broad bipartisan support in the House as well. But not one single Democrat signed the conference report. What changed? What happened? I don't know. They object out of the blue after they've already voted for this to a new mandatory, which means a different type of funding out of the Appropriations Committee, was not added to this bill in conference. Some apparently believe that without this funding, CARA is not worth passing. Well, I strongly disagree for the reasons I'm going to line out. And this is not the view of the over 200 treatment organizations that are in favor of this conference report. Groups like Addiction Policy Forum, the American Psychological Association, the National Association of Counties, the National Association of Addiction Treatment Providers. These groups are calling for quick action on this conference report. They wrote a letter saying, quote, "The report is truly a comprehensive response to the opioid epidemic, which includes critical policy changes and new resources." New resources. The letter continued, quote, "As you know, 129 Americans die each day as a result of a drug overdose. And this epidemic affects the public health and safety in every community across the country, not to mention the devastation, and I've seen it in my own community, to families all across this nation. This bill is the critical response that we need." As a member of the Appropriations Committee, we all worked hard to ensure that our states have the resources they need to win this fight. And I will not stop in this fight. The appropriations bills we pass in our committee provide substantial new resources. Under these bills, total funding to address heroin and opioid abuse will more than double the 2015 levels. You can see this. In 2015, it was $220 million. In 2016, we did a 46% increase to $321 million. In the bill that came out of the Senate Appropriations Committee that was supported bipartisan, 46% increase, $470 million. Those are significant resources that can help and will help in the treatment and gets money to our providers and to our states for block grants. Let's look at what just the HHS discretionary appropriations that we passed in the appropriations bills that passed bipartisan. In 2015, $41 million. In 2016, $136 million, a 237% increase. This problem has been escalating across our country, and you can see it reflected in the dollars that we're spending. In 2017, a $262 million and 93% increase. These are significant. It goes to problems that help with research, treatment, community health centers. This is a very significant rise. And then our last chart is in the conference report that we are now considering now. It goes out of the Senate with $78 million more dollars, and the conference report comes back 181, 132% increase. Again, the urgency of what we're seeing here is reflected in the real dollars that we're willing to spend. So don't listen to the argument that no money's being spent. It couldn't be further from the truth. This is what has been decided and agreed upon in a bipartisan way in the Appropriations Committee to deal with this very, very, very difficult problem. So I think that 94 members of this body already voted for this $78 million. Why in the world would we continue this feud, I think, that's created and bubbling up in a political fashion, and turn our backs on a 132% increase in this conference report? As I've shared on the floor several times before, this problem is particularly hard-hitting in the state of West Virginia, the state I represent. Unfortunately, West Virginia sadly leads the nation in drug-related overdose deaths, more than twice the national average. More than twice the national average. That means that I mentioned 129 Americans die every day. That means there are people dying in West Virginia in larger numbers per capita than any other state in the union. It also means we shouldn't be taking the time for partisan politics and delay the passage of a much-needed piece of legislation. I say this all the time because I believe it to be true. I hope it's not. I believe we're in danger of losing an entire generation to this scourge if we don't act with force together and make sure that we not only fund our programs, but we do the comprehensive approach to it that we see in this CARA bill. I was on the floor yesterday talking about how we have witnessed Senate Democrats playing politics with critical funding for Zika, and now we're seeing a repeat. I hope we do not go through this same scenario. Let's just not play political games with the veteran, depending on the VA's ability to help them treat their opioid addiction, or the newborn the newborn born dependent on opioids, or the addict who's willing to seek treatment and needs the help that CARA will provide. They do not deserve to be held hostage to a political situation. I will proudly support the passage of the CARA conference report, and I encourage all of my colleagues to do the same. I yield the floor, Mr. President.